Hello, I'm Kevin Kunzman, Managing Editor of Contagion. Here's your update on our COVID-19 coverage for May 6, 2020. A new study out of France indicates the virus had already arrived and spread there in December 2019, long before the perceived start in Wuhan, China. A retrospective review of a man discharged from a hospital in Paris on December 29, 2019, showed his collected respiratory sample indeed tested positive for the virus, moving up France's identification of the first known case by an entire month. Surprisingly, the 42-year-old patient had no apparent link to China, was a longtime resident of France who worked as a fishmonger, and had last visited his native Algeria in August 2019. The patient had a history of asthma and type 2 diabetes and came to the hospital's emergency ward with symptoms including a cough, headache, and fever. He was given antibiotics, responded favorably, and was discharged after just 2 days. New research from the Mount Sinai Informatics Center in New York shows that patients receiving anticoagulants reported a lower rate of in-hospital mortality due to coronavirus than infected patients who did not receive blood thinners. Investigators led by Dr. Valentin Fuster, physician-in-chief of Mount Sinai Hospital, assessed the health system's patients treated for COVID-19 between March 14th and April 11th. Anticoagulant-treated patients who had also required mechanical ventilation reported decreased mortality rates compared to control. The team advised physicians consider anticoagulant use for ER-admitted patients who are deemed at a greater bleeding risk. Skin injuries among healthcare workers wearing personal protective equipment are highly prevalent, and as much as half are going untreated, according to new findings. Investigators from China reviewed 4,300 healthcare worker survey responses in order to understand the prevalence, characteristics, and preventive status of skin injuries caused by PPE among medical staff responding to the outbreak. As many as 80% of workers reported that different skin injuries damage their health and increase their risk of infection, with each worker averaging about 2.6 skin injuries apiece. For more on these stories and more infectious disease news, please visit us at contagionlive.com. For Contagion, I'm Kevin Kunzman. Thanks for tuning in.